Liposuction is if the skin is good, you're within 5 or 10 pounds of your ideal body weight, you have isolated areas of body fat resistant to diet and exercise, and you have good realistic expectations, you are a good candidate for liposuction. Well, there are a lot of people who that makes bad candidates because their skin's not good, or they're 20 pounds overweight, or they're overweight everywhere. And again, the best candidates get the best results. Everybody else gets something different. So how do you get fat? You know this. You get, aging, your hormones change, your body furnace has not got the same metabolism, you get childbirth puts on weight that's just not going away. The genetic, your parents are big, it's going to happen. And then, of course, my problem, the Big Mac pizza attack. Here's a lady beforehand, you think, what is she doing here? And I agreed with you, except when you find out she was in the gym, 8 times a week. She's eating bark and roots and berries and twigs, and she's still got a little bit of excess in these areas. So we go in very cautiously because I can mess that up. It's pretty darn good, and I don't want to make her worse. So we cautiously, with an incision right there, get at that fat, and an incision right here to get at that fat. So we use that one to get, there are 2 incisions per treatment area. And here she is afterwards. You can see her skin right here isn't quite as good as we'd like it to be, so the result is not exactly perfect. Here's a result that's a lot easier to do because she's got a lot of issues. She's got sort of that cello look, and you can see we're able to smooth that out. So even if it's not perfect, it's going to be a lot better. You can also see that cellulite is not improved by liposuction. There are some things out now called cellulase, and when it gets proven to be a technique that works reliably, then I may get one, but I don't have it yet because I'm not convinced. There she is from the front. She's a young patient, so even though she had lots of extra skin because she was young in her 20s, it still had elasticity in the skin and it would contract. If she'd have been in her 50s, that would have been hanging there as thinner. She'd have been thinner, but she still had all that skin. And you can see maybe a little incision there. I think there's one maybe out here. So that incision is used to get at the tummy and also to get at the hips. Hips, outer thighs, inner thighs, better. Incision there, maybe a little one there. Guys do chest, do abdomen, do hips. Works pretty nicely. This is the kind of thing you come in, you go to sleep. We do all these, you attack these areas, put you in a garment. You're in the shower 2 days later. Stitches are out at a week. 3 weeks, 4 weeks out, you got 75% of your improvement, and a full 3 months before you see everything. Everybody's swollen. There may or may not be bruising. It's numb for a while. All of that comes back to normal. This is the gold standard for body contouring, just like facelifts are the gold standard for facial rejuvenation. We're going to talk about cool sculpting in a minute, which is pretty cool as well, but it's not the gold standard. So, liposuction again. Big tummy, smaller tummy. She's not an ideal candidate, but she got a nice result. So if you have realistic expectations, that's the best. Got to have that. So what's wrong with this picture? I agree, it's a nice result, thank you. But if we had any idea that that bottom would ever wear that thong, we'd have moved those incisions over. But who knew she was going to ever wear that thong?
Where's the incision?
Well, see a little one there, a little one there, a little one there, one under there, one right there. But those we could have moved over. She could wear a bathing suit like that in South Beach. We'd have moved her incisions over. But I didn't know she'd ever wear that with that bottom. Outer thighs, inner thighs, tummy. Incisions at 3 months, still a little red. Same thing. She doesn't really look like she needs liposuction, but that's a better. Yeah. Same thing. Outer thighs, inner thighs, hips, better. Hips, outer thighs, inner thighs. Okay.